Hello, everybody. It's my pleasure to introduce Nancy Ross to our discussion today. Nancy is the Assistant Director of Clinical Pathology and Quality at Montefiore Medical Center, and she brings a wealth of expertise in the laboratory operations, regulatory compliance, and quality management. Nancy, I'm super thrilled to have you with us today, and thank you so much for joining the conversation.
Thank you so much for having me.
So today I wanted to talk a little bit about proficiency testing and compliance. And my first question to Nancy would be, who actually evaluates proficiency test results? And what criteria are used to assess a lab's performance?
Yeah, Irene, I think this is a great topic to be discussing. There has been some recent changes in proficiency testing as well, so I'm sure we're going to get into that a little bit later. But I think the first thing we need to do is to really define what proficiency testing is. Laboratories are required to perform proficiency testing, and to explain it in simple terms, proficiency testing is really just blind sample analysis. And we use that in the lab to evaluate the accuracy of the testing process. Now, this includes more than the analytical portion of testing. It includes evaluation of the pre-analytic and the post-analytic phases, as well as every aspect of the testing pathway, because it's equally important.
Mm-hmm.
Proficiency testing is interesting. It was instituted by via the CLIA law
Mm-hmm.
in 1988.
Mm-hmm.
And it was a significant move to help us regulate and establish standards
Mm-hmm.
for laboratory practice and quality expectations. Proficiency testing became a requirement for laboratories as part of their quality checks to demonstrate competence as well as good quality standards. Now, there are different proficiency testing providers, and each provider ships the materials to the laboratories, and they're also responsible for evaluating the results and establishing the acceptability criteria.
Mm-hmm. I see. So ultimately, PT would act as quality assurance measure to ensure reliability and detect any inconsistencies in the lab's testing, right?
Correct. And the interesting thing is, so if you have a proficiency testing sample, you have to meet certain levels of measurement. Whereas, when you have a patient sample, you don't. So the idea is if you have a blind sample go through your system and you're able to achieve expected results, then we know that patient testing is being done in an accurate manner. It's one of the checks we do. Laboratories do many other quality checks.
Interesting.
Proficiency testing is one of them.
Interesting. Okay. Do proficiency testing samples mimic at all human samples? And how are they distributed? Based on what?
Sure. So proficiency testing samples mimic patient specimens, but they're not 100% patient samples. If we
Mhm.
think about all the different laboratories that a vendor has to support, and all the different tests that have to be performed, the stability that these samples need to have when they're shipped from the vendors to the different laboratories, as well as the tight ranges that you have to meet in order for a particular proficiency testing result to be accurate.
Hmm.
These samples are made essentially, so they even though they mimic the matrix, what we call the matrix, so whether it's blood, urine, plasma,
Hmm.
but they're not 100% patient samples.
Yeah. Yeah, that makes sense. Because the real patient samples might not be always feasible, right? And the goal is to ensure
Correct.
that the
Or
proficiency.
they might not have the correct measurement that is needed, right? So remember,
Uh-huh.
these samples are very specific. They're shipped to the laboratories, and they have to sort of meet, the acceptability criteria in terms of the results that they obtain.
Right.
And in terms of the distribution, each laboratory signs up with a specific proficiency testing provider that matches the test menu that they have. And so that's how that's done. There's a number of providers in the US,
Hmm.
and laboratories have their option. Most laboratories that are CAP accredited usually have the proficiency testing by CAP.
Hmm.
And there's a few exceptions to that depending on the platform that they have and the test menu that they're responsible for.
What is the blind testing and why is it used in the lab? Why is it
Sure.
called blind testing?
Happy to expand on that. So, blind testing ensures that all aspects of testing were followed correctly in order for the right result to be obtained. For example, a laboratory may have a great analytical phase process, as many laboratories do these days, just based on the instrumentation that is used, and in some cases, even automation,
Hmm.
as has become the norm. However, any mishandling of specimens in the pre-analytical phase, any issues with temperature when the samples are shipped, maybe samples were left out to sit for too long, or
Hmm.
they were mixed incorrectly, etc. All of those factors ultimately affect the final outcome of the results. And so we also see issues in the post-analytical phase. And essentially, the blind testing helps you ensure that all processes within your workflow are being followed and done accurately. So we like to say in the lab that blind testing really tests the accuracy of the whole process. And if a laboratory does not do that, that's when we see issues with the results. And or it could be issues with your instruments. It could pinpoint issues with training of the staff,
Hmm.
maybe not following the procedure, etc.
Got it. So it kind of serves as a safeguard to catch the errors that might otherwise go unnoticed if it wasn't for the blind tests, correct?
Exactly.
So what corrective actions are required if, let's say, a lab somehow fails the proficiency testing?
Sure. So when a laboratory fails proficiency testing, they have to conduct an investigation and they have to determine what is the root cause of the issue. Most laboratories have a proficiency testing failure investigation form that they have to complete. And that goes through all the different aspects. You know, we mentioned it could be transportation issue. Maybe there was a temperature variation. Maybe the sample sat for too long, maybe the samples were not mixed correctly
I
or
see.
tested accurately, etc. So the corrective action is really to investigate what was the root cause of the issue and then to put a corrective measure in place so that not only the results of the proficiency testing are accurate, but most important, we have peace of mind that our patient samples that are going through our system are being reported accurately.
Yes, so it sounds like the key here is to be proactive, to have that sort of approach in order to avoid it. I see.
Yes, and it's very important to understand that, you know, we're looking at the whole system. It's not as we're looking at the blind sample and the proficiency testing as a quality check that lets us know how our system is performing. And so when you have a failure, it's, you know, the thought is, okay, let's identify what area. Was
Hmm.
it on the pre-analytic area? Was it during the analytic phase we had an issue? Did we report out incorrect results during the post-analytic phase? And so we want to go back and figure out what type of
Hmm.
retraining. Maybe we need to look at the you know, our quality control again, our quality assurance. Maybe there's an instrument issue that some of your other measures have not picked up on, and the blind testing did. So it really serves as a quality measure, looking at the entire system, and it helps us identify issues within our process that need to be taken care of.
Yeah, yeah, that makes a lot of sense because the corrective action is not just about fixing one issue. It's about looking at a process as a whole, right?
Correct.
Um, what happens if, let's say, a lab fails the PT multiple times? Do they get in trouble for that?
The answer is yes.
Yes,
Unfortunately,
yeah, the answer is obviously yes.
yes. If a laboratory fails PT multiple times, it can face some serious consequences.
Mm,
I think it's important to understand why, as we were mentioning, proficiency testing is a test of the accuracy and reliability of the
mhm.
laboratory's processes. Now, this has direct impact to patient testing and patient care, and government organizations such as CMS takes this very seriously. There's a
Mm-hmm.
process that escalates depending on how many failures and the
Mm-hmm.
successes of the corrective action, right?
Okay.
So, if a laboratory has multiple PT failures, they can receive a notice that's called cease testing
Uh-huh.
until the issue is resolved. So that means they need to stop testing that particular test until
Mm-hmm.
they have fixed, whatever issues were encountered.
I see.
Oftentimes, this requires a process of verification by the agency. So even after they get their problems fixed,
Mm-hmm.
the corrective actions need to be sent to the agency, they need to be verified, etc. And so the process to get reinstated, let's say that the laboratory did get a cease testing notice,
Mm-hmm.
is the process usually entails passing two proficiency testing surveys and providing a detailed documentation of the changes that were made. And in some cases, in worst case scenarios, when laboratories don't do the correct process of investigation and corrective action, then their CLIA certification can be revoked. So
Right.
they're unable to operate. So proficiency testing is very serious business, and most laboratories are aware of that. And
Yeah.
so
Yeah, it's
it's taken very seriously.
Yeah, that's definitely a high stakes situation here. Because oftentimes when I am contacting managers and directors and supervisors regarding my candidates for follow-up, they're usually saying, sorry, we have the proficiency testing happening and it's a busy time for us. So I am
Absolutely.
familiar how stressful it is for the lab leadership and for the entire team of the lab.
And one comment to add there is that really proficiency testing should be handled the same as patients. So, if a patient sample goes through the entire process, it should be no different than the proficiency testing going through the same process. The only difference is that because it is a blind sample analysis, we do know, for example, the target result that we should get. And when we don't get that result, then that goes back to identifying issues that it might be impacting patients as well. So the actual handling of the blind testing sample and the patient samples should be the same. It must be the same. But the one thing about the blind sample analysis is that we can always go back and say, there is an issue. Now we need to do an investigation and figure out where the corrective actions need to be applied.
Heard that there have been some recent changes in proficiency testing. I don't work in the lab directly. I am daily in contact with lab directors and managers. But does it make things harder, more complicated after those changes have been implemented?
Yeah, I don't know that it'll make things harder, but there are some changes that everybody should be aware of. There was a recent revision to the CLIA law that governs proficiency testing, and the changes actually went into effect January 1st this
This
year.
year. Okay.
Exactly. And I think among the revisions, there are additional analytes or tests that
Hmm.
are now required to have proficiency testing, where in the past they were not required. And there were some that were removed. And in general, I think the ranges for the acceptability criteria was also changed. In particular, I think some for our microbiology departments
Hmm.
that is important for everyone to be aware of. There is some guidance from CMS out there, and not sure, when this podcast comes out, if you want to provide the
Sure, we
link
can put that in the notes as well.
for your listeners to check out
Sure.
with sort of like an FAQ on what are some of the changes and where the guidance is so they can
Yes.
get more information.
Yes, this is some really helpful information, Nancy. Before we wrap up, I just wanted to thank you for sharing your expertise today. Your depth of knowledge and clear explanation have made this a really insightful conversation. And I appreciate your time, and I'm sure that our listeners will find this discussion incredibly valuable. And Thank you so much for joining me again today.
Thank you, Irina, for having me. It's a pleasure.